Hello, welcome back to my channel Magic of Medicine. So continuing with our last topic regarding pleural effusion, we will today talk about the diagnosis of pleural effusion. So the first line of investigation is chest x-ray. There are three kinds of chest x-ray that we can take, and the mnemonic is D, E and S. D for decubitus, E for erect PA view and S for supine x-ray. So first and foremost is lateral decubitus one. So lateral decubitus is most sensitive view and it is taken by keeping the effusion side downwards. Next comes the erect posterior anterior radiograph. It is the most commoner one. And the first sign which we see on this x-ray is blunting of lateral CP angles. And it can detect minimum of 175 ml of pleural effusion. Then comes the supine x-ray. Supine x-ray is taken only and only when patient is unable to stand erect and patient is very sick, that is ICU kind of patients. So in supine radiographs there is very less sensitivity. However, you can see there is a notable increase in density of lower lung zone because of the underlying pleural effusion. So you will order a chest x-ray PA radiograph most commonly. However, it cannot detect very less amount of pleural effusion. So if you are suspecting a effusion and not seeing it on a erect view, you can order a lateral decubitus one because it is the most sensitive one. Now this is the favorite question of examiners. They ask you what is the minimum amount of pleural effusion which is detected on a x-ray. So you can say that a minimum of 50 ml is required to detect on a lateral decubitus chest x-ray, and for erect PA view minimum of 175 ml of effusion should be present, and supine is least sensitive. It needs at least 500 ml of pleural effusion to be able to detect. Now, what are the signs on chest x-ray which point towards the presence of pleural effusion? So firstly, there is increased homogeneous density superimposed over the lung fills, which leads to blunting of costophrenic angle, and later on it can also cause blunting of cardiophrenic angles. It also obliterates silhouette of diaphragm, and if it is very large, it can accentuate right minor fissure. So these are the signs, 5 signs which point towards presence of pleural effusion. However, it can be confirmed only on ultrasound if it is dicey kind of situation, or CT and MRI obviously. So now coming to the signs, proper named signs of pleural effusion. So first one is meniscus sign and second one is apical capping. Apical capping is a very known specific sign. It can be seen in pleural thickening and can be seen in pleural effusion. However, meniscus sign is a kind of very specific sign for pleural effusion. Now I will show you about meniscus sign. So see this x-ray. What you can see is a homogeneous density which is obscuring the left CP angle, the left dome of diaphragm, left cardiac border, and also the opacity is causing a meniscus sign. This one is the meniscus sign. So this sign is specific for pleural effusion, and you can confidently say that this is left-sided pleural effusion. Now, how will you describe a pleural effusion while reporting or while reading a chest x-ray? So, you can call it as a homogeneous opacity seen in right lower lung zone obscuring the right CP angle, right dome of diaphragm and right cardiac border, suggestive of right-sided pleural effusion. And look, this here is also giving the meniscus sign. Now, coming to this example, this is a case of massive right-sided pleural effusion. Why are we calling it massive pleural effusion? Because this pleural effusion is so large that it is causing contralateral mediastinal shift. The whole of the mediastinal shifts towards the contralateral side in case of massive pleural effusion. So this whole thing is pleural effusion. Thank you for watching the video. If you found the video useful, please like, share and subscribe.